Welcome to the next episode of the Link podcast with Community Link Consulting. We have our guest joining us, John Browne from CHAS Health in Spokane, Washington. John is the Chief Strategy Officer and the Chief Operating Officer at CHAS Health. Welcome, John, and maybe you can start off just giving us an overview of your journey and history at CHAS and how you came to start there.
Sure. Yeah. Thanks for having me. So first of all, I guess I'll just say that I've been with CHAS for a little over 20 years now. I'm not terribly old, so I've been here my entire professional career, as some of you might imagine. So it did not start there in high school, like some people think. But honestly, fell into it a little bit by accident, I guess one would say, but I was graduating undergrad and in my last couple quarters here at a local school, and I needed an internship somewhere. I grew up on a farm in Central Washington, so I had zero kind of real life business experience other than farming, which is a lot of experience in and of itself. But I was going to go into some sort of financial industry, economic industry type of role. And so I called my dad up, who was CEO of Mosley Community Health Center at the time, and see if he had any ideas. And he knew our founding CEO, Peg, really well here at CHAS and got me an internship. And before I graduated, Aaron, who's our current CEO now, offered me a job in finance. So that's kind of how I got here to begin with. Had no intention on staying whatsoever, but offered me a job right at the kind of beginning of the Great Recession back in 2006. So I took it and thought I'd stick around just for a couple of years, get my MBA here locally again, and take off. And I never left. So it's kind of how it came to be.
All right, that's great. Yeah, I was just talking to somebody today. You have quite a few longtime people who have stayed at CHAS, and I think that's a real testament to the organization. Exciting to see that longevity.
For sure, yes.
And I think one of the things we had talked about too is how fun it is that you're a second generation FQHC Community Health Center person, that your parents were involved and now you're at that next generation. I was just talking to somebody today, CFO at a health center, and his mom was a CFO at a health center for 20 years prior to that. So really interesting to see how that comes together. So awesome.
Yes.
So for listeners who may not be familiar with CHAS, can you give an overview just of the services, the size, and a little bit of the history of the growth?
Sure. Yeah. So we were founded back in '94. So we're a relatively newer health center as far as health centers go. Spokane actually went, for being a fairly large metropolitan area, went quite a while without a major health center, kind of taking root and, being based out of here. And so, Peg, like I mentioned earlier, and a handful of others started CHAS back in the day. Started as a little 2-exam room clinic in downtown Spokane on Sprague, and it's just kind of has really grown. I would say it grew a fair amount before ACA was implemented, but it was really the Affordable Care Act and Medicaid expansion in Washington State that caused CHAS to really start to grow at a level that, where we got to now, along with many other health centers. And so we are mostly in Spokane, or I should say mostly in Spokane County, but provide services kind of all over Eastern Washington. We also have 2 clinics in Idaho, one in Moscow, one in Lewiston, and in a dental clinic in Clarkston, Washington. And so we've got about 29 sites, including 5 school-based health centers. We serve about 130,000 unique patients annually and have over 1,800 employees, FTEs. I think we might have, getting over 1,900, getting close to 2,000 individual staff. But we've just really grown. I mean, before COVID, we were growing minimally 15% up to 25 to 30% per year for a while there. COVID obviously kind of slowed things down to some degree. We didn't have a lot of physical infrastructure, physical plant growth after that, but really started to do a lot of infill and continue to grow both top line revenue and just patient volumes. Not as much on the patient side. We started seeing our patients just more frequently in a lot of our expansive services that we have. But anyways, continued to grow, and now we're once again starting to add locations again and kind of looking at that next phase of growth for CHAS. But we provide just like the typical health center, comprehensive primary care. We do OB, pediatrics. We dabble in, little specialties. We've got rheumatology. We have a little bit of ortho. We have an HIV program. So different things like that. We have a pretty substantial behavioral health program now. That was a strategic priority from the board a number of years ago. I feel like it was over a decade ago, and we really started to grow our behavioral health just to meet the need in the communities that we serve. And we also now have 2 community behavioral health clinics, certified community behavioral health clinics, CCBHCs, one here in Washington, up by Holy Family, and then one down in Lewiston, Idaho. So yeah, we provide the gamut of services. We've also got 2 urgent cares. We've got a dozen dental clinics. We have over 100 dental chairs throughout our system now. And then everything that's a little bit unique, not as unique as it used to be, but we have a large pharmacy system. So we've got in-house pharmacies at every single one of our medical sites, including our 2 urgent cares. We have clinical pharmacists in all of our locations. And we also have a pretty major centralized mail out and compliance packaging program at another location. So at this point, they do about a quarter of all of our scripts org wide. So yeah, I think that's about it. I'm sure I missed calling out a few things, but that's most of it.
Yeah, so that sounds like a really comprehensive overview. It's really interesting to me that you're still making plans for growth, because I know this is a really challenging time for health centers. And so it's interesting that you actually have plans for growth. What do you think has contributed to that, being able to be forward-looking in a growth mode like that?
Well, I think part of it is just inherently kind of who we are philosophically in our culture. I mean, we've always strived to continue to meet the need in the communities. If we see an opportunity or we see need, we kind of go about trying to figure out how to meet it, whatever that looks like. We've now got a pretty expansive mobile health program as well as street medicine program. And so there's a lot of other non-brick and mortar, clinic services that we offer now. But I will say our growth, especially with physical infrastructure and brick and mortar clinics, has really been a lot more intentional. And we've just had to really prioritize where and when we grow and how we add new clinics, partly because the revenue streams, the margins aren't there anymore, and we have a real need to figure out other creative financing or capital, or whether it's federal requests, state requests, whatever that looks like, that we've got to kind of create a better capital package for growth. And the other thing that we've leaned on lately for growth, that includes actually what will most likely be our next physical clinic, is in collaboration with Frontier Behavioral Health. But what we've really leaned into is growing alongside our partners, our partner organizations that we have strong relationships with. And so that's been super key. A lot of our sites have been due to us being asked to either come into the community. We have plans for an Airway Heights clinic here in the near future as well. And that's an example of a community that's asked us to come in. Most of our out of Spokane sites came to be in a very similar fashion, but even within Spokane now, we are leaning on community partners, and the Frontier one being a good example of one where they really need more primary care access on their main campus here in downtown Spokane, and we need more behavioral health access. So it just made sense. But yeah, the growth is we're not, at one time we were adding 3 or 4 clinics a year, and that is not even close to reality anymore. But, there's still a huge unmet need here in the Spokane area. And I think it's more just trying to piece together, the dollars and the community partners or whatever it takes to figure out how to add sites. So.
Mm-hmm. Yeah, that's really interesting because it feels like with everything you outlined that CHAS is doing, it feels like the need would be met at this point. So very interesting that you point out there's still a lot of unmet need. And you
Yep.
mentioned the community partners. One of the things that we've been talking about here at CLC is, especially with the rural health transformation funding that's coming out, how important it's going to be for health centers to be partnering with others in their community and the hospitals to make sure that they're able to maximize use of those funds. What advice would you have for health centers, large or small, with developing those relationships with community partners?
Well, I think, first of all, I'd say those partnerships are absolutely crucial to the success of a community health center. I mean, no matter what size you are or what scope of services you offer, no community health center in the country offers the full gamut of services that a patient's going to need for healthcare. And so, and then you look at the fact that the physical healthcare you're providing these patients is a small portion of their overall wellness and what contributes to that wellness. And so I think partnering with organizations is crucial, and if you're not, you should be. And I think first of all, it gets your name out in the community so that people know that you're available, and those community partners know that they have a place to send these vulnerable patients and complex patients, but also creating those inroads and allowing your patients access to a lot of those services with community partners is very crucial to their health. And I would say for us, what we found is that it really is our ability to create those relationships is what causes our patients to have access to a lot of these services. I think without them, particularly when you look at some of the big hospital systems and specialty systems, they're generally not taking Medicaid, they're not taking uninsured patients, they're not taking, a lot of the folks that we serve. And so without kind of strategic partnerships and us helping them in certain ways and them being willing to open access up to our patients, that just wouldn't happen. And so we rely extremely heavily on our partners. And and then like I said, we have housing partners, food partners, you name it as far as social services. And I just think that, and especially with revenues the way they are, margins the way they are, reserves the way they are for community health centers, and our inability to meet the total need for these patients, I think that's the only way you can do it, is leaning on partners and hopefully also providing them some revenue streams to keep them open and successful and help them stick around and be viable.
Mm-hmm. Yeah, I love that focus with the community partners is what can we expand to be of service to our patients, and also that mutuality that you are helping the partners. Like it sounds like it's more of a true partnership versus one getting benefit over another. So I love those 2
Exactly.
points.
Yeah, and I would just add to that too, that I would challenge anybody, because I think it's always going to be there, to find those mutually beneficial arrangements. We know that community health centers provide a huge amount of value and impact to these patients, and without us, they'd be sitting on the front steps or the EDs or whatever of these systems, and causing them to expend resources that could be used elsewhere. So they've got a real incentive to get these patients into primary care. There's other partners too that we lean on that I would definitely challenge folks to think about in terms of other payer partners, whether it's managed care organizations, state agencies. Whoever's paying the bills also has a huge incentive for these patients to get the care they need in the right place, which most of the time is in a community health center. So I think there's other leverage points and other, I would say, partners and folks to think about with all that.
Yeah. One of the things that's interesting to me that I've heard with hospitals, just as a generalization, is they have to staff their emergency department 24/7. So in some ways, there's not a huge incentive for them to support the health centers because they've got to see people anyway. Like they already have the sunk cost of the emergency room. What's your thought on that, and how do you communicate with the hospital as a FQHC, talking about how we can support the patients versus they're looking at, we've got a sunk cost anyway, so seeing patients isn't as big of an expense as it might seem to be.
Yeah, and I would say that's true to some degree. And I think it probably depends on the hospital and the location or the region that they're in. But I can tell you from our experience, particularly in the Spokane area with these hospitals, yes, they want to see patients, but they don't necessarily want to see any and all patients. And I would say, they're still dealing with, at certain times, certain days, issues of, being overcrowded and having too much volume, patients waiting hours and hours and hours. And so they would prefer to see patients that truly need ED services and are appropriate for that level of care. And to be totally frank and blunt, have the right type of insurance. Yes, if they're open and they're available and they're sitting there anyways, they'll take the whatever it ends up being, 10 to 40 cents on the dollar for these Medicaid visits, but they would prefer to see higher paying commercial patients and, folks with different insurances. And also I think the staff are really challenged when you have these repeat emergency room users and folks that are coming in constantly for unnecessary ED visits. I think it not only frustrates the staff, but they know they've got to go through the whole rigmarole of seeing the patient and doing a checkup or workup and whatever they do, when this patient has severe mental health issues or has other healthcare issues, complexities that could be better dealt in a primary care setting. So I think it's true that they want to see volumes, they want to be busy for sure. They don't want to be sitting idle, but our experience has been they're busy enough, and they would like to partner with organizations. And the flip side of that is then some of these patients, Medicaid uninsured, end up getting admitted to, and they definitely don't have the inpatient capacity most of the time, nor do they want their beds being used up by folks that would be better seen in primary care and could get better in a setting like that. So I don't know. I think it goes both ways, and I've heard those same stories as well. And there was a time where some of the partner hospitals here were saying that, but I feel like especially since COVID, that tune has changed a little bit, and they would prefer to get these people the type of services in the right setting rather than in their ER. So.
Mm-hmm. Yeah. That's a great point. And I appreciate that both sides of it, that it's better for the patient and it's better for the workforce because they're under tremendous pressure as it is. And then if it's one more thing with mental health or physical health not being managed on that ongoing proactive way, like it can be through primary care.
Yep.
You've mentioned several times about behavioral health and the CCBHCs that you have. One of the things that I've noticed with some of the health centers we work with is that they're used to primary care. So we know how to manage the visits and the providers and the workflows. Behavioral health sometimes can feel like it's a side add-on that's a struggle for people to manage. It sounds like you guys have the secret sauce for that. What are some of the tips that you would have for managing that as a separate service line, if you will?
Well, yeah, it took some time and it wasn't without a lot of trial and error. I guess I'll just start with that. And part of the reason why we ended up implementing our CCBHCs was primarily just out of necessity in the community. We actually tried to lean on some of our community partners to go that direction, and they weren't interested. It wasn't within their wheelhouse. So we kind of felt like we needed to answer the call in that area. But Yeah, I would say it is unique providing healthcare within the FQHC umbrella. And so I think it's important to kind of have your guardrails, I guess, or boundaries, for lack of better words, in terms of what you do provide. So just as an example, we still heavily rely on Frontier Behavioral Health and some other community mental health partners for a lot of those kind of um, more acute, higher level type services. And I think, we have not gone deep into that realm. And so we provide a lot, primarily integrated behavioral health within CHAS. And so very integrated within our primary care. A lot of it, we have recently implemented expansive counseling services, but traditionally our services have been more of that short, brief intervention types of services. And so, having somebody get in there, do that evaluation, figure out what's going on, potentially get them on the right medication, but then work with our community partners if they need more extensive services and something beyond what we can offer. And so that was tricky early on, just having those boundaries and understanding what we could and couldn't do, and making sure that it still fit the model of an FQHC. I mean, obviously we're encounter based, and so there are different parameters when you're thinking about it from just a financial sustainability perspective. But it's gone really well on the CCBHC side specifically. That was a huge learning curve for us. And we started slow and small with our Spokane site. And again, just I think it's about getting the right staff in there in those roles and making sure that they fully understand the FQHC environment and what we do, and not just creating another community mental health center that's, completely separate from your health center. And so I think, they're very integrated within CHAS and understand what we do and what we don't do. And anyways, I think that's important. And it was quite an experience just getting that off the ground. And obviously it's resides under the SAMHSA program at the federal level versus HRSA. And so there's a lot of other requirements and, nuanced type of stuff that we had to make sure we were doing under that program. But it's been, successful so far.
Okay, great. Then just as far as CHAS's growth overall and just some of the challenges that you've had in scaling, because it has been so much growth, do you have any examples of just interesting things that you've gone through and maybe challenges you've overcome in scaling to the size you are now?
Yeah, I would say a couple of areas that have been challenges, especially when the money was really flowing in and we had the reserves, to open new clinic. We've generally been paying for things. We don't have any long-term debt, so we've been paying for new buildings and capital growth through our reserves historically. And so it wasn't the financial pressure of adding another clinic. And this was, of course, before things went totally bonkers with um, cost of construction and supplies and all that to build a clinic. So building a clinic today is understandably significantly more multiples of what it used to be pre-COVID. But so we didn't have the financial pressure. What I would say it was more the cultural pressure and ensuring that we kind of got to a point probably a few years ago where we just really realized, like, oh man, we've gotten really big, and especially because of COVID and just all the impacts that had, we're having this feeling like there's a significant number of our staff that just don't truly understand or aren't bought into the CHAS culture. And that's always been super important to us, is just to maintain that kind of culture that's woven across our system, and that we don't feel like just because we've gotten big, we've got all these disparate individual siloed clinics and independent little cultures. And so I think just that's been a challenge as we get close to 2,000 employees, just keeping them all grounded in our mission and why we do what we do and who we are and what our core values are. That's that just gets hard, both from a communication standpoint to that many staff across that kind of service area. And then as well as the fact that, we used to do even annual all staffs every year where we would literally get every single person in the company together for a big all staff. We haven't been able to do that in forever because of the size and because of how spread out we are. So that's a challenge. I would say the other one is more around operational efficiencies and being able to keep the momentum. We are still figuring that out. So that's not been a nut we've completely cracked yet, but I would say we're going in the right direction now. But that's hard as you grow, your focus is more on growth and adding and building. And you tend to maybe slack a little bit or not have the time to prioritize operational efficiency and including just being lean and efficient, but also, actual efficiency as far as production and volumes and the patients being seen. And so we got a little lackadaisical on that. And so that's what our biggest focus has been probably over the last at least 3 years, once we kind of fully came out of COVID, has really been around efficiency and being lean. We had our hiring freeze and admin about a year and a half ago. So we've really slimmed down our administrative staff and cost. And it was perfect timing with AI and technology and all that, because that's kind of what backfilled that capacity rather than new bodies. But just kind of leaning into new models of care and helping our existing system and clinics be able to do their jobs easier and see more patients and feel good about it. So.
Okay, great. Well, I feel like there's a lot to talk about in there, but one of the things that comes to my mind is, what are some of the tools, your favorite tools to use in monitoring or increasing efficiency, whether it's technology or even just some kind of management frameworks?
Yeah, I would say, having good, and this sounds simple and it is, but having good dashboards and reporting tools and we have a BI department, business intelligence department, but just having good tools to be able to regularly track that data and that performance, I think is key. And not just from an executive leadership perspective or senior management perspective, but from an end user, boots on the ground in the clinics. And that's something we're doing right now, is we're actually overhauling some of our dashboards and scorecards and things, even at a clinic level. And so I think it's really important that the clinics not only value and buy into, where we're heading and where we're going and what we need to do from a performance perspective, but also just have the visibility and the tools to get there. And so that's a big one. I would say another one is having really effective project management in your health center. So I think having people that have the capacity and ability to lead initiatives and have the tools and the wherewithal to understand if things are going in the right direction or need some additional support or resources. And so for us, we've got an internal project management department. I think I would say, regardless, if I were CEO of any size health center, I would at least have one person that can take that task on, that's not buried with a bunch of other operational work or daily work, but can truly have the capacity and take the time to manage process improvement initiatives or projects or workflow improvements. But I think that's important. And then lastly, I would say I think it's crucial to rely on your leaders. Coming from an executive senior management perspective, relying on the people that you've entrusted to oversee that work, I think is really important. They're the ones that are going to understand, even anecdotally, what's going on, have a better finger on the pulse, and letting them do their jobs and get out of their way and just be available for support is, I think, a huge way to support improved efficiencies.
Mm-hmm. Yeah, that's really interesting because that's one of the things we've been talking a lot about lately is being able to rely as a C-suite leader, relying on the people that are reporting to you and the systems rather than you having to know all the details and getting involved, but you're able to rely on the systems and the people that are reporting to you. So,
Yep.
yeah.
Exactly.
And I love your comment about visibility too for people throughout the organization. We were just talking this morning. Somebody had mentioned the movie Moneyball. I don't know if you've seen that with Brad Pitt. And there's a piece of that where they've got one number that everybody has to focus on, but it really does drive a lot of clarity. And when people know what that is, they know what they're aiming for.
Exactly. No, 100%. And I would say, closing that question too, that's something that we've really strived to do more recently is prioritize our focus and our initiatives and really just get the entire system. Like right now, we're implementing a huge team-based care model across our system, but just getting the distractions and the noise out of everybody's minds and getting them to focus on one big thing and having all of us rally around that, whether you're in an administrative department or out in the clinics, I think is super crucial. So rather than trying to do, which we've always done, a million things at once, and you end up looking back in a year or two or five and you're like, well, we've made good progress, but if we were to all rally around one or two things, I think it just helps you get that much farther, that much quicker, and ultimately do a better job at getting it done.
Yeah. Yeah, it's interesting because I was just talking to Mike Weiser the other day, and he was talking about doing sprints to accomplish things. And so that's one of the things we're talking about here too. So yeah, it's interesting. And it's interesting too, just about how you're talking about your leadership team at CHAS, the things that you notice about yourselves and the things that you're focusing on, because leadership teams do have a personality and there's a makeup of the team. And it's interesting to be able to look at that and say, what are the things that we as a group get excited about and might be not necessarily blind spots, but what are the things that we have to do a little course corrections, or what are improvements that we can make?
Yep.
So,
Yeah.
okay.
Yeah.
Great. So one of the other questions I had for you is, being CFO and now moving into Chief Strategy Officer, Chief Operating Officer, how has that background with data and finance served you as you move into these other roles?
Oh, I guess just summarize it by saying it's been invaluable. I think it was very crucial to have that background. When I first came on, I was in finance. I dabbled in operations for a little while and then became CFO about 14 years ago, before moving into the COO role last fall. And I think those 13-ish years of being in that CFO role and we were growing at the time, and I was in more of a strategic CFO role. So particularly once I was able to bring Krista Albrecht on, and she really managed the rest of the finance, in-house, account, all that kind of stuff. It really allowed me to move up to that more strategy role, and that was huge and very instrumental in my current role. And I think it's a great background to have because you learn the business side in and out. You understand the revenue model, you understand the very intricate details of an FQHC and what drives it from a cost and a revenue side. You understand pharmacy really well. And so I think all that's unique because then it just really helps you prioritize the work on the operational side and understand what's important and what's not for your operational leaders to focus on. I think a lot of times if you don't have that background, they get caught up in prioritizing things that at the end of the day aren't hugely beneficial to the business and might be a waste of time for staff. It maybe is invaluable or not impactful on the patients either. And so I think that's important. And then I think the other piece of that is it just really made me understand the value and impact that a COO CFO partnership can have. And so, Crystal moved up into the CFO role when I moved into this, and her and I have always had a great working relationship and a good partnership. And I think it's been solidified even more now that we're each in these roles. And so I think that's also super critical and has allowed, my prior experience in CFO roles allowed me to be able to have conversations with her that, might be more Greek or might not, be understood as well if you don't have the finance background. So, yeah.
Mhm. Well, and I can even see too, and this adversarial is probably too strong of a word, but sometimes there is that tension between operations and finance. And so I'm sure that helps bridge that gap and be more collaborative when you can see both sides of it.
Yes, absolutely. And I know exactly what you're talking about because I see it all the time. I was on a COO group meeting today with Idaho COOs, and yeah, it's always been humorous to me that, in many health centers, and for me, it almost feels like the majority of health centers, the COOs and CFOs do not see eye to eye, or, are not as close and as good of friendships, partnerships, anything you want to say, as we've had here. So, and I've always been, even in my CFO role, I was always very close with operations. I worked with operations every day. And although I wasn't in my current role, I knew what was going on. I had a great relationship, a good partnership, and I have always seen the value in that. And so I think, when I moved over into this role, it just was natural, and, having a good trusted partner, and Crystal was an easy one. So.
Mhm. So what do you think has contributed as a CFO, just that natural partnership that you had with the operations? What do you think contributed to that?
I think, well, part of it's probably my personality. I'm not a hardcore CPA accountant guy. So I always enjoyed looking at more of the business side of things rather than the pure accounting financial side. And so working with the people that actually made it all happen and helping to, what's the right word, impact or kind of persuade their work in a way that would be beneficial on the business side was always something I strive for. But I think it's important for CFOs to kind of get out of the day if you can. It depends on the size. I get some CFOs do everything. I mean, they're responsible for checking payroll off and getting bills out the door for accounts payable and making sure journal entries are done at the end of the month. So I totally understand that everybody's in a different place, but I think to the extent you can, I think it's really important for CFOs to move out of the day-to-day accounting and finance work. And I think that's when you can start to think more strategically and think more operationally, and what would be beneficial for the organization, the business as a whole. Start to look at industry trends and community trends, needs assessment, things like that, and be able to partner closer with your operational counterpart to help kind of implement strategies and implement operational tactics that can help curb what you see coming down the pipe. So yeah.
Mm-hmm. Great. Yeah, I can definitely see that. Like, even if you can just take, and I know for, like you say, for some CFOs, they're doing everything, but
Yeah.
even just taking an hour or two a week, just completely out of the financial and the accounting and focusing on one piece that you suggested, I think that would be really helpful.
Yeah, I agree. I think, yeah, and just to add to that too, I would really challenge anybody, even if you're the smallest health center in the region, that I'm sure you have time to carve out an hour or two, like you say, to just sit down, have coffee, have a chat, whatever, with your COO or your operational counterpart. And I mean, ultimately, you're the expert on the finance side and on the business side. You're the one that should know all the numbers. And I would say if you're at that level, you probably know the numbers more than anybody. And so I think just, using that information that you have to tell a story about what you're seeing and where we're going, and what potential threats and opportunities you see coming down is hugely valuable for operations and for anybody else in the organization. So.
Mhm. Well, and that phrase, using the data and the knowledge that you know so much about to tell a story, I think that is so key, because I think those of us who are immersed in the numbers and you just very naturally understand things and put them together, that's your day to day. But it isn't the day to day of maybe somebody in operations. So if you can create a story that makes it much easier to understand, and it also makes it more compelling, that's just one way to make the communication easier.
Yep, exactly.
Mhm. Yeah. One of the things you mentioned too, when you were talking about when you first became CFO and all the things that you learned about, it's a lot of things in an FQHC to learn for a CFO. What would you recommend for people that are, like, we talk to people who are, their CFOs are coming into the FQHC world. We say it's at least 2 years to really start getting your arms around what's happening in FQHC. What would you advise people to do to get a handle on what's most important to look at the beginning and how to get their arms around everything?
Yeah, and that lines up with what I tell people too. I usually tell folks 3 years even before you're, kind of fully grasping concepts and ideas and feeling, or I should say, maybe it's when you're feeling more comfortable with the work and where to prioritize. The biggest thing that the biggest advice and feedback I give to whether it's a new CFO or a new executive is just to lean on your network, lean on your kind of groups, whether, you have a CFO group, or whether just getting a hold of other peers, around the state, region, or, I've got, colleagues and peers literally across the country, almost every corner of the country that I lean on for things. And, I think that's what I've seen is like the most critical difference between CFOs getting up to speed quickly or kind of stumbling through it for years and years, and then they finally pick their head up when they feel more comfortable. And it's usually way down the road. And I just think it can really speed things along for you. I think every health center is very unique, and if you're a brand new CFO in a health center and don't have a lot of internal folks to lean on, and maybe don't have the prior CFO to lean on, it is going to be drinking out of a fire hose. And it's going to probably feel like that for a very long time. And you're probably going to spin your wheels even just thinking about what the heck you're supposed to prioritize or where to even focus. But if you were to reach out to a CFO that's been around a long time, has experience, understands the industry and understands the health center system, because there are so many similarities amongst health centers, I just think they'll be able to point you in a better direction and help you understand concepts, help you understand where to focus, where your biggest bang for your buck is, so you're not chasing pennies when you could be going after, much larger sums and dollars in the business. And so I don't know, that's what I would say is just get engaged, network with people. If your health center has the funds, go to conferences, just get out of your health center. I mean, it's important to learn the intricate details of your health center, but I also think it's as valuable, if not more, to get out and learn from other people and create those networks.
Yeah. Yeah, I think that's a great point. And it's a small world. It's a small industry when you think about across the nation how many health centers there are and CFOs. And I think especially accountants can be hesitant because they're so conscientious, hesitant to ask for help because they feel like they should know it or they should be able to figure it out for themselves. But
Exactly.
it's not necessary, and it's too much really to try and do by yourself. So I think that's great advice, to take advantage of those relationships as much as you can.
Yep.
So
Yep. Agreed. And I think you'll just fast track not only yourself, but your organization. I mean, that's a key role. So I would also just think of it as a fiduciary responsibility to reach out and get that support and help, because your health center is relying on you getting up to speed and thinking out of the box and being creative. And although they might be able to give you the time, I think most health centers don't have that luxury of giving somebody years and years to get up to speed. If revenues are going down, margins are getting slimmer, which they are for the most part, and they need CFOs that can get up to speed and get on top of things as quick as possible. So.
Mm-hmm. Yeah, I think that's a great perspective, looking at what is best for the organization and what's being a good steward for the organization, because there can be so many competing priorities. And I do find that if you can step back and say, one perspective is what's best for the organization, that can help give you a lot of clarity as you're trying to make a decision about what to prioritize. So,
Yep.
let's see. I also had a question just as far as developing future leaders. What are some of the things that you are looking for in future leaders, and what are some of the things that you like to do to mentor people along?
Yeah, I would say first and foremost, just just getting in that mindset of taking a leap of faith on new leaders and younger leaders. And that's one thing that I would say goes all the way back to our kind of founding CEO, Peg Hopkins, is she always, something I really appreciated, and honestly is the reason I'm in this role and was in that CFO role as early as I was in my career, was just that she really took it on herself to give opportunities to young people and to people that, showed potential, for sure. So it wasn't just anybody, but also folks that, she saw were kind of up and coming and showed promise. And so I think it's putting yourself in that mindset to take that leap of faith and to invest in folks and really bringing them in, giving them a safe place to take some risks. Obviously, you don't want to put anybody, particularly a new leader, into a position of taking a risk so big that it could have a major impact on the organization. But I think there are ways, to minimize that risk and to put them in a safe place where they can fail and they can mess up, and it can be a learning experience, and you can help them through that, rather than it being something that has such a major impact that you've got to do something dramatic like letting them go or whatever that might be. And so I think, just not keeping all the information and decision making at the top, I think, is important in developing leaders, and letting folks have the space to make their own decisions and helping them understand, or help walk through, I should say, maybe the justification for their decision and why they're making it, without, being overly punitive or judgmental about it. But I think it's the biggest thing. It's just, giving people space. I would say the other thing is making sure that you're giving, it's crucial to make sure you're giving folks tools and resources. I think it's important to have an open door policy in your organization for folks to walk in and ask questions and bounce things off of. At CHAS here, if you ever come into our administrative offices, we have glass walls everywhere. Feels like a fishbowl, but people can see me right now, that are walking by. And so it's, it just feels, it's more inviting and generally feels safer for somebody to be able to come in, rather than having a bunch of closed up doors and walls everywhere that you can't see anybody. And so giving folks that opportunity, and supporting them if you financially can, to getting additional training and support, even external to the organization. So sending new leaders to conferences, sending them to trainings, upgrading their skills, but feeling like, make them feel like you're investing in them and taking their growth and development seriously, I think is important.
Yeah, I think I love that point about giving people the opportunity to fail and not being too judgmental on them. Because especially if it's not just so high stakes that it's, like you say, something that they would need to be terminated over, that is huge for them to be able to go through the process of learning by doing and making a few mistakes along the way.
Exactly. Yeah.
Yeah.
I mean, that's exactly how I would have wanted it. And that's how we did have it, growing up here at CHAS. So I think I would definitely want to give back in that way. And I think it's important for people's confidence too, just as they develop into a leader, creating that confidence. And it's one of the hardest things, I think, is that especially if you're coming in brand new to CHAS, you don't know our culture, you don't know who we are. I've seen people just get scared to make decisions or feel like they've got to bounce it off of 20 people or, get permission to make a decision. And so I think instilling that confidence and making folks, particularly leaders, feel like, it's going to be okay, and just, use what you've learned and apply what you know in that decision-making process, and make sure you have a good reason for making the decision. I think that's the biggest thing is we all probably would make decisions differently. I know Aaron and I, our CEO, for example, don't always see eye to eye or would have made the same decision on everything, but he has trusted me, and feels like I've at least thought through the things that need to be thought through and have run it by the people that it needs to be run by. And I think that's the most important thing, is just giving them the tools and kind of instilling that process of decision making onto new leaders is important, so that that they're going through the steps.
Yes.
Just making flippant decisions.
Yes. Well, and I think too, you made the comment letting people know that it's going to be okay. I think that is a huge piece too, because if they do make a mistake, that you're there to help them. If there's something that needs to be corrected, something we need to do, most things are not such a big disaster that you can't come around and work some things out and move things forward anyway.
Exactly. No, I think you see a huge difference with leaders that make decisions based off of fear versus make decisions based off of confidence. And I think to me, it's night and day. The leaders that are fearful of repercussions or worried about their decision, or, worried about the consequences of their decision, tend to make bad decisions. And they waste a lot of time and resources getting to their decisions usually. But the people that are confident tend to make better decisions and tend to do it in the right way. So.
That's great. Well, I really like that. I was going to ask you for any closing words that you have, although I felt like those would be great closing words right there. But anything else that you want to share, or something you had on your mind for future leaders of FQHCs, or just leaders today in the FQHC world?
I know this is a time of, I don't know, it's a time of fear in general in our country. And I know a lot of health centers are a lot of concerns, and, there's a lot of threats out there for sure, and are worried, understandably worried. I mean, I'm worried all the time too, but I think there's still opportunities out there. And I think it's important to, even when you feel frozen or fearful, to move forward and keep moving forward, and have that confidence and take on opportunities, seize those opportunities when you have them or when you see them. And it might take more thoughtfulness, it might take more creativity to get where you need to go, but definitely is not a time to sit idly by and put up your defensive walls and do nothing, because I think that you will get into some real trouble by doing that. And I'm glad that CHAS has never been a health center to do that, but I've certainly seen other health centers that do, and it's not a successful strategy at all. And so I think just being creative and being responsive, it might be in your community, it might be somewhere else, but responding to those opportunities and kind of still having that entrepreneurial core value within your organization like we do, I think is critical in this environment, because there's so much unknown, so much uncertainty. We're back to where we've always been as far as future funding for health centers, and we've got HR1 coming down the pipeline next year, and Medicaid enrollees dropping off, and so there's a lot of reason to be fearful. But I think your worst nightmare will come to fruition if you don't do something about it and figure out other ways to make your health center successful and provide services to your communities.
Okay, great. Well, thank you, John. I appreciate it. I think that's good encouragement for everybody, and I just appreciate you taking time to talk today. It's been great to hear some of your insights in your journey. I appreciate it.
Absolutely. Well, thanks for having me on.
All right. Well, thank you.
Thanks.